We are again. Hello, back again, everyone. Kia ora. And hey, Asha, my
Barbara,
favorite discussion partner here.
looking forward to this part two. Some more hopeful happenings in the world.
That's right, and we'll see. We'll just see where we go with it. Something we mentioned before, and I let you mention the New Zealand doctors in the DOS. What the stuff that they're doing here. But on a global scale, where these doctors are also, to my understanding, they're also aligned with and connected with, is a newly formed World Council for Health. And they kicked off on the 23rd of September, 2021. And the World Council for Health launches today with a clear-cut mission to provide the latest unbiased scientific guidance as collected from around the world. The doctor-led guidance is to help the public make the best health decisions. It kicks off with a comprehensive guide on how to manage COVID-19 at home. The World Council for Health is an umbrella coalition starting with 45 health-focused groups from around the world. And so on and so on. So we will put the link in here under the video. And what I thought we could do today is, so the architect for this messenger RNA platform or technology is a scientist called Malone, Dr. Robert Malone. And he actually, I've got a video here that we can share when recorded at the time when I think 6,000 physicians, doctors from around the world signed the Rome Declaration. And that just happened, I think, last week. And I would like to see if I can share the screen and maybe we can just listen to that together.
Sounds good. Did you call that, was it the Rome Declaration?
Yeah.
Okay. Yes, go. I think
Let
this
me
one.
see. Okay, I've got to first go on to that. Hold on a second. All this new learning that we have. Asha. So that is that. Share screen. Share.
And just make sure your volume's up a good amount.
Thank you. Yeah. Can you see that okay?
Yep, perfect.
So I share with you.
Okay.
So I share with you a physician's declaration developed by physicians in Puerto Rico that met together last week. And I ask that you consider joining us in this declaration. We would very much appreciate support from the world and particularly from physicians. So I'm going to read this declaration of the COVID Summit in Rome, Italy. We, the physicians of the world, united and loyal to the Hippocratic Oath, recognizing the profession of medicine as we know it, is at a crossroad, are compelled to declare the following. Whereas it is our utmost responsibility and duty to uphold and restore the dignity, integrity, art, and science of medicine. Whereas there is an unprecedented assault on our ability to care for our patients. Whereas public policy has chosen to ignore fundamental concepts of science, health, and wellness, instead embracing a one-size-fits-all treatment strategy, which has led to more illness and death than the individualized, personalized approach to healthcare. Whereas physicians and other healthcare providers working at the front lines, including those here, utilizing their knowledge of epidemiology, pathophysiology, and pharmacology, are often first to identify new, potentially life-saving treatments. Whereas physicians are increasingly being discouraged from engaging in open professional discourse and the exchange of ideas about new and emerging diseases, not only endangering the essence of the medical profession, but more importantly, more tragically, the lives of our patients, you in the audience that are listening. Whereas thousands of physicians are being denied the right to provide treatment to their patients as a result of barriers put up by pharmacies, hospitals, and public health agencies, rendering the vast majority of healthcare providers helpless to protect their patients in the face of disease. Physicians are now advising their patients to simply go home, allowing the virus to incubate and the disease develop, and to return when their disease worsens, resulting in hundreds of thousands of unnecessary patient deaths due to failure to treat. Whereas the above is not medicine, it is not care. We cannot sit idle while patients are forced to go home and sicken in place. These policies may actually constitute crimes against humanity. Now, therefore, it is resolved that the physician-patient relationship must be restored. The very heart of medicine is this relationship, which allows physicians to best understand their patients and their illness, to formulate treatments that give the best chance of success, while the patient is an active participant in their care. Resolved that the political intrusion into the practice of medicine and the physician-patient relationship must end. Physicians and all healthcare providers must have the freedom to practice the art and science of medicine without fear of retribution, censorship, slander, or disciplinary action, to include possible loss of licensure and hospital privileges, loss of insurance contracts, and interference from government entities and organizations, which further prevent us from caring for patients in need. More than ever, the right and ability to exchange objective scientific findings, which further our understanding of disease, must be protected. Resolved that physicians must defend their right to prescribe treatment, observing the first tenet, do no harm. Physicians shall not be restricted from prescribing safe and effective treatments. These restrictions continue to cause unnecessary sickness and death. The rights of patients, after being fully informed about the risks and benefits of each option, must be restored to receive those treatments. Resolved that we invite physicians of the world and all healthcare providers to join us in this noble cause as we endeavor to restore trust, integrity, and professionalism to the practice of medicine. Resolved that we invite the scientists of the world who are skilled in biomedical research and uphold the highest ethical and moral standards to insist on their ability to conduct and publish objective, empirical research without fear of reprisal upon their careers, reputations, and livelihoods. Finally, resolved that we invite you, the patients, who believe in the importance of the physician-patient relationship and the ability to be active participants in their care, to demand access to science-based medical care. In witness thereof, the undersigned has signed this declaration as of the date first written. We invite all of you, physicians, scientists, patients, to join us in this resolution to protect the integrity of medical practice.
Wow, that was outstanding. Yeah.
Pretty cool.
Mm.
Pretty cool. Hold on a second. Where are we now? Yes. So more, I think, you know, how we said, there's more new systems being put in place.
Mm.
I heard of teachers here in New Zealand speaking up.
Mm-hmm.
I haven't followed the link. I haven't got the link. I'll have to find out where they meet. More independent journalists. I really want to applaud Brendon Malone and the Dispatches blog or podcast. But yes, wonderful stuff happening. It was a very good presentation, wasn't it?
Yeah, that's excellent. And what he mentioned about political intrusion into the medical profession, as you just now said, the exact same thing has happened to the media. You know, so we need each of these bodies, each of these bodies to actually gather their morals and re-center themselves in exactly the same way, and go back to their principles. What were the founding principles, you know, of these professions?
Yeah.
That's really there. That's really encouraging. So that's the World Council for Health.
That's right. The World, what do they call it? The World Council for Health. Yes. We can put the link. We can put the link in our underneath in the comments. They've put together a lovely website with resources, research paper. I mean, so much has happened along those lines. There's an incredible amount of information also on the Corona-Ausschuss page. A lot of their sessions are held in English or with English subtitles or with English parallel translations now. So that is Corona-Ausschuss, AUSSCHUSS.de. You'll find they've been talking since July last year. They've been talking to experts from any field around the world. I think they've interviewed about 150 people. The sessions are always quite long, but very informative. Always keep your hat of discernment on. Some, like we've seen happening, there's quite a lot of people who probably do this so their YouTube viewer numbers are increased, and you'll always get that. Every session I think is just so valuable, and that is I would, you know, Asha, I would love our governments around the world, and let's just focus on New Zealand. I would love them not to say, I am your single source of truth. I would love them to say, we hold available these resources on our COVID action plan. Please, you know, have subgroups where you can link in and get the information that you haven't got. I mean, what a difference that would make. You know, I mean, treat us, like you said in our session before, treat us like intelligent human beings, not like children that have to get told of where to sit, where to stand, how to speak, or I want to believe, and I will always want to believe, that we would totally be able to handle this, to have the right information about an endemic or a dangerous virus going around. This is what really is happening, and now invite the team of 5 million into the discussion. We have ways of doing this now, you know. We ask people, so what is your approach to maintaining good health in the first place? What you know, ask the nutritionists, ask the naturopaths, the homeopaths, and allow them to bring themselves in, and not just say this is how we're doing it, just because it is a panic situation and we've got to maintain this for 18 months. You know, no panic situation ever happens that way. Where I find it a real affront, I don't know what you say in English, but a real attack to the human mind is this playing with this panic. We all know that if you if you set a house on fire, or if a house is on fire, not set a house, and there is panic inside the house, everybody in that house, the first person who makes sense, who speaks with a normal tone of voice, with not an accelerated breath, but actually seemingly, able of all their senses, that is the person that gets listened to. That is how firemen train as well. And that's exactly the strategy that has been used. Create a huge amount of panic, scramble up our minds and hearts. And then now we are your only source of truth. I find this embarrassing, an embarrassment to the human mind. I mean, every single person I am in contact with and I'm friends with, or that I meet, are very capable human beings.
Absolutely. Yeah. Yep. No, that's something I struggle with as well, is the myopic nature, the very, very narrowing down of our thinking, to the absolute detriment of our ability to respond as a collective. That's why it's so heartening, I think, to see more and more people speaking out and realizing how very wrong this is. And maybe this is a good segue for those that are unaware about the New Zealand doctors speaking out with science, who have been quite active since the early stages of what's going on, and speaking out around what they see as a lot of wrongdoings. I might just bring up their website just to show people, and we will pop the link as well in the description of this video. So this is the New Zealand Doctors Speaking Out with Science website, nzdsos.com. So you can see very clearly they have very strong concerns around the messaging that is coming from our government and many of the institutions, and they feel the need to make it really clear that the COVID-19 vaccine is voluntary and vaccines may not be forcibly administered. And so if you click through this, it will take you to a letter from the New Zealand Human Rights Commission, a reply to the New Zealand Doctors Speaking Out Against Science, that actually goes into some detail around their concerns. So while the New Zealand Human Rights Commission is not doing much at the moment, they are getting feedback, and you do need to let them know if you feel discriminated against or if your rights are being violated in any way. But I do recommend that people check out this website and get on their newsletter as well, and support any people within these institutions that are speaking out, because usually they are doing so at risk to themselves, but out of a necessity to out of conscience. Yeah.
I like it that they put this, this is the most pressing issue at the moment, and with the vaccine, and what I really deeply, I don't have words for it, almost really deplore, is our Prime Minister's Facebook post last Sunday about side effects. Let's talk about side effects. And in the meantime, I think it has gathered 36,000 people commenting on it. Those are, in my team of 5 million, those people commenting, those are people who have lost friends, relatives, family members. The pattern is always the same. It's the blood clotting. It is the outbreak of shingles and herpes zoster, other herpes zoster, like cold sores, you call it, and disease and like very serious side effects. And the myocarditis is a very big concern, especially obviously for young sporty people. I've got a somebody sent me a collection of all the sports people around the world are gathering
Yes.
and reporting from around the world of what they have witnessed. The list is endless, Asha. It's like endless, you know, football player suddenly having a heart attack in the middle of a practice, and you can't ignore that. You cannot ignore that.
No, that's right. Some of them are becoming quite vocal about it because it means the end of their careers. It's just tragic.
And you mentioned in an earlier discussion, you mentioned you know, the other effects that all this had, and I want to look at the I don't want to call it mental health. It's such a wrong term. But let's just say mental, you know, the all around overall wellness and well-being, and the psychology is of course a big part of it. The soul psychology, speaking for mind and soul. That's the translation, right?
Yeah.
And I mean, I know personally, I know of 2 people, one younger person, one in their 60s, who at the beginning of lockdown committed suicide. That is that and the side effects I see, and the deaths resulting in time relation shortly after the vaccine, let's just say. That I don't know, I think we said this before, I know of one person, of one only, in my field of, you know, I've got quite a large number of people that I'm surrounded with. One person who had the virus and the disease, COVID-19, diagnosed and since recovered. One, we know in New Zealand we had 27 deaths. I think maybe they assign a couple more deaths now to the new Delta variant. That's all. Those 36,000 comments, who's looking at that? I mean, all it has created is around the world, it has created a media joke, really, because of course it was forwarded and shared all around the world. So millions of people around the world have seen this and have read through the comments and shared it in their countries shortly before probably getting censored and deplatformed. It is, you cannot stop the truth.
No,
You
that's
just
right.
cannot stop the truth, and it is a discussion that needs to be had, similar to back in 2010 with the swine flu. And I'm grateful to people then, back then, people who spoke up, and I do applaud people like Dr. Vodak, who put an end to the vaccination back then. The vaccination that led to, I don't know how many hundreds and thousands of people falling ill with narcolepsy and are still struggling. Their life has been over since.
That's right.
So, and the first thing they did with a person like him, at the beginning, when, you know, he was one person who got very alert when this whole thing started. He used to be active in the European Council, in political parties, and so he was speaking up right at the beginning, and he was the first one who was totally shredded to pieces in the public, and portrayed as this evil, whatever they call people, critical thinker like that, and a wide series of people and experts and people who I would love to listen to, because they are able to look at complex systems in all ways. But yes, so, and disease, like we know, I mean, you and I are passionate about human health, amongst others, and helping others to get well again. And we know how yes, complex that may seem, but also how unbelievably able humans are to get well again.
Oh, yeah.
Yes, I mean, it is phenomenal. It is really phenomenal. I just wish someone well, that's maybe our job here, Asha. Someone would stand up and say, you are powerful beyond belief. It's not just one immune system. You've got a couple of immune responses, and you've got a wonderful way of getting well again. It's a few steps to learn, to know that the body keeps the score of any adverse childhood experiences. For example, the body is your it gives you signals. Signals. There are symptoms, and if you work through them, then those symptoms can help you evolve and heal, and ultimately heal. But yes, so we've got a bit of a task at hand still to get people back on the track of physical health sovereignty as well.
That's
you
right.
know?
Yeah, absolutely. Yes, well, maybe we can finish off there today, and and pick up again maybe next week. And I just would like to extend my thanks and gratitude to you and to all of those people who are standing up for humanity at this time, and just ask that we protect those people who are in institutions who are putting themselves on the line to stand up for us, like these New Zealand doctors and this new World Council for Health, and that we support this new declaration reorienting medicine back to the Hippocratic Oath, and back to the patient-doctor relationship, that sacred relationship.
That's right. And like, it's a holistic approach. It goes into, like you mentioned before, journalism. It goes into law itself.
Yes.
I think it's becoming, or it has become, really, really acute. Or everyone has been becoming aware of our judiciary system is corrupt. It's video. Hold on. Our legal system, judges, lawyers, judges, I just want to call on them. You came to this profession because of, hopefully, a profound sense of justice, to uphold justice. And similar to policemen, you came to this profession, well, I suppose so, to protect the people, to look after them, to make sure no harm is done. And I saw this video of this lawyer in Portugal. I can't remember his name now. He created this habeas corpus movement, which just, it means I have a body and therefore I have a right. And a brilliant guy, and he stands up to policemen because they were smacking people for not wearing masks. And it's beautiful, this video, how he stands up. He said, "Don't you dare hitting any of your people. You're supposed to protect them, And yes, so it's a call for everyone to return to their roots, to remember what brought them to their calling, to their professional calling. Yeah. But yes, I applaud you, and I thank you, Asha, for your time, for your energy, and for doing this with me. It's good fun. We're getting there. We've got this.
Definitely.
Yeah.
Hear the call, people.
Yes.
All right.
Okay. All right. Thank you. And now up to living life in the real world for a moment.
Yep. Till next time. Thank you, Barbara.
Okay.
And
thank you.
Yep. I'll catch you next time. Thank you, my friend.
Okay. Thanks, everybody. You can do it, guys.
Yes.
Okay.